We're going to talk about reflexes and in particular the stretch reflex. So the muscle spindles, as we talked about, sense length and velocity changes, and it results, if they're triggered, it results in a reflex. And a reflex is basically a motor pattern that you don't think about, right? So it's not a volitional movement. So it basically goes from a sensor straight to the spinal cord and then has a response. So sense, straight to the spinal cord, and then there's a response. For the stretch reflex, so here's our biceps brachii. If you're holding, say, a load, and then somebody adds more load to it, it kind of drops that load on, you can imagine that your elbow will go into extension. It'll kind of drop down. There will be a fast length change in your muscle. The muscle spindles will respond, and the response will be that the muscle fibers will begin to contract. So the muscle and the muscle spindle stretch as the arm drops, and then the reflex contraction is initiated by the spindle, which results in muscle shortening or muscle activation to flex your elbow joint and shorten the biceps brachii, because this whole reflex is trying to not have the biceps brachii lengthen quickly and basically rip. Another way to see if your stretch reflex is functioning well is if you go into the doctors and they tap your patellar tendon, right? So if you tap the patellar tendon, that puts a fast lengthening on your quadriceps. And then the resultant stretch reflex is to activate your quadricep muscle. And that's when you see your leg extend, and you have not thought about extending your muscle, but that's what happens. And so two things actually happen with this stretch reflex. So you tap, you have a length change, it goes to your spinal cord. The first thing is that the quadricep muscle contracts, and the hamstring muscles, which are the antagonists, are relaxed.